For all intents and purposes, no one goes to a healthcare facility for the heck of it, not just as a fun trip. No. Being in a hospital, clinic, pharmacy, dispensary, or a patent medicine store is out of necessity. Sometimes it's a life and death situation. So when individuals are in any healthcare facility and stamped as patients, they expect to get treatment from medical staff working with proper equipment. By its very nature, a healthcare facility ought to deliver services round the clock, night and day, rendered by qualified physicians and allied healthcare providers. 24 hours a day, 7 days a week. That's given. In doing this, the patient is entitled to being treated with dignity, kindness, and respect. In a hospital, patients look to getting the full complement of staff support and care. The patient should also be involved in decisions about his or her care with a full attention from staff. Some of other expectations of patients include the need to be listened to, the need to receive clear explanation and instructions about their conditions, the need to be treated by staff who show care, concern, and compassion. In addition, patients desire to be attended by professionals in the medical field. These are typical expectations from a standard, well-structured hospital. In reality, however, the contrary prevails in several situations. That ideal has been stained by the mishandling and ill treatment of patients by some healthcare personnel. Patient neglect in hospitals is today a huge cause for concern, especially with views that such are often willful and intentional. There have been several reported cases of drug overdose, wrong prescription, faulty diagnosis, newborn switch at birth, and abandonment of surgical instruments in patients' internal organs. Quite often, these bad, unorthodox, and unwholesome practices cut across levels of healthcare delivery, from the primary to top-level tertiary health institutions. Hospital neglect can lead to injury, unnecessary extra treatment, deformation, or even death. Unfortunately, millions of cases go unreported each year. Some of the major categories of negligence are failure of health workers to follow standards of care, failure to use equipment in a responsible manner, failure to communicate, failure to document, failure to assess and monitor, and failure to act as patient advocate. When the hospital personnel fail to follow the standard of care and instead endanger, ignore, or harm the patient, these have severe repercussions. Hospital neglect or nurse abuse are non-legal terms that fall under the umbrella of hospital negligence and some cases misconduct. For some time now, in Nigeria and other parts of the world, a patient with a gunshot injury must provide a police report before treatment is administered, even at the point of death. Doctors and hospital administrators still insist on a police report before treating a gunshot injury. This is in spite of a 2019 resolution by the Nigerian police that no police report is needed before any government or privately owned medical facility admits and renders emergency services to any victim of gunshot wound. According to the police, every medical facility in the country is free to receive and treat victims of gunshot wounds with or without police clearance, but duty-bound to report the nearest police station after commencing treatment of the victim. Adherence to this directive is, however, still questioned, and in other countries, the practice still prevails. Other cases of patient neglect in hospital range from lack of care and attention to the patient by health workers, aggression towards patients, total abandonment of patients, and in some cases, health workers go as far as abusing patients sexually. This is the case in so many countries across the globe. Arguments that these health facilities are overstretched and that personnel are stressed, though valid, are not an excuse to mishandle, ill-treat, abuse, or neglect patients in distress.